LGBTQIA people are disproportionately impacted by COVID-19 because of discrimination and limited access to healthcare and education. Lockdown measures have left many in homes and communities where they face violence. In fact, South Africa's shelter programs seldom cater for the needs of LGBTQI+ people, and as a result, Lerato La Basadi, a group of mothers and relatives of queer people, came together this year to open a shelter in Gauteng called Turning Tides. Now, to speak more about this, we're joined tonight by the shelter spokesperson, Nandi Msezane. Nandi, a very good evening to you. Grateful for your time on News at Prime. Welcome. What have you seen as the highest level of need during this period, especially for LGBTQIA people plus?
Okay. Thank you for having me this evening. So it's been multiple things during the pandemic, everything from shelter, because people are either in situations where they've had to go home, and home is not a safe place for a lot of LGBTI persons. So they are sheltered and were locked down with families who are either homophobic or transphobic, or anywhere in between. But home was a very dangerous place. And then people have lost jobs. So that also makes it more difficult to survive. It's been more difficult to access medication, especially when you're talking about people, trans persons who need to get hormones and other medication. And then also just people who are LGBT, and I think the rest of the society who has been needing to either get access to ARVs or PrEP. It's been more challenging during this time.
And just on the issue of healthcare services, you mentioned trans people, for example, who need access to hormones. Is it an issue of the facilities back home simply not having resources, or even in urban areas such as Johannesburg, where because they are, even in some cases where staff at hospitals and clinics are homophobic, there's a barrier of fear where people don't want to go in because you don't want to subject yourself to that sort of ill treatment?
Okay, so I think it's both. For instance, in some, so like this has a health program, particularly for trans persons and people, particularly trans men, were talking about how it was more difficult to access the hormones they need because of stockouts. So it's not just because the staff, because the center at Vets is targeted at the trans community, the staff is educated, the staff is welcoming, but because it's been more difficult to access different kinds of, whether it's medicine or other stuff coming into the country, there have been stockouts of medication that is needed.
So yourselves at Turning Tides, you are fairly new as an organization. Just how much are you able to do to help?
We're trying to do as much as we can, but it is a drop in the ocean, right? The kind of violence that LGBTIQIA persons in South Africa are facing. The last study, which was done by the other foundation, Progressive Prudes, said there's about approximately 800,000 people who openly identify as LGBTI, which may not in the big picture look like it's a lot of people, but most of those people are facing huge challenges, particularly when it comes to violence, with a lot of South Africans saying that, they still don't, even though we have this great constitution, most ordinary South Africans still don't accept LGBTI persons. And so we are facing, as a community, backlash from within the communities and families that we come from.
I wonder then, Nandi, if you've got a network, given the fact that you're working with limited resources here, is there a network of like-minded organizations that you can, in some cases, refer people to if they've been either rejected by their families or ill-treated in the health sector?
Okay, so one of the reasons that Lerato La Basadi, with a group of us who are from the community and are activists within the community, came together to form Turning Tides is because Gauteng one of the biggest provinces in South Africa, with a huge majority of just South Africans in general, and other people from other countries who come and live in South Africa. We did not have a shelter that catered for LGBTI persons. And even though there are shelters, whether you've experienced violence or not, oftentimes those shelters, unless you are cis het, so if you identify as the gender you were assigned at birth, it's very, very difficult to access a shelter. So particularly for our trans community, it's really, really difficult to access shelters when they're homeless or they've experienced violence. And
currently, as we wrap then, are you welcoming assistance from the public then?
Yes, we are.
What kind?
So everything, so the shelter, like we say, is fairly new. So we do need things for the shelter, so like appliances, money, donations in kind. Yes, and people can contact us. We have a Facebook page, Turning Tides, which has our information. We don't have a website yet, so even skills are important. People who can offer their time and skills to the center, to the shelter, because we're also looking at how do we help people become employable so that they're not going to live in the shelter forever, but they're able to move on and rebuild their lives from the shelter.
So Christmas is, just a few days away now. A lot of people will be lonely because, as you said, they don't have good relationships with their families, shall we say, because of homophobia. Can they come through to your space?
Yes. So on Friday, we're having what is called Queer Mass. So we're going to be having a Christmas lunch at the shelter. So you can email us or you can call us to just let us know that you'll be joining us so that we have catered for enough people. Observing COVID restrictions, we're trying to limit it to 50 people just so that there is enough space for everyone. And we're trying to keep everyone safe as well. That is important to us, as well as the residents in the shelter.
Nandi Msezane, good to speak to you. She's spokesperson for Turning Tides, a shelter for LGBTQI+ people.